Good morning. I want to welcome everyone to the 4th Annual International Women's Day Global Health Symposium. Our symposium is a major event of our Women and Global Development Forum, which we colloquially call WAGDIF, which started 10 years ago as a small roundtable series and is now composed of 6 very large events each year, as well as this annual health symposium. Every Global Health Symposium, for those who've been here before, will be focused on a theme, and this year is no different. The theme today is looking forward to the health of the next generation. Girls and young women are often affected most by health challenges, and they typically don't receive the support and resources that boys do. This happens in the developing world, and it happens right here in Chicago. Today's discussion will explore the many issues, why they persist, and also the solutions that are now emerging to these health challenges. Each of today's panel will be live streamed, and I encourage you to take to social media, though if you could put your phone on vibrate rather than ringing, that will help everyone. All of the relevant handles for social media are in your program booklet. A symposium like this would not be possible without the many, many supporters of peoples and institutions that we have. We're delighted to have partnered with 30 nonprofit organizations who have been engaged in the development of the conversations you will hear and take part in today. I encourage you to get to know them face to face, to go down to the second floor where many of them have set up information booths and allow you to learn more about what they do. We're also extremely pleased to be supported by a group of longstanding and loyal donors who believe in this series on women and global development and in the symposium. Many have been with us since day one. Our lead sponsors today are Abbott and USG, and we have patron sponsors from Citadel, the Frankel Family Foundation, the Holtus Trust, Kirkland & Ellis, Ashley and Avery McCall, Skidmore Owens, and Merrill. It is with their support that we are able to offer so many tickets to students groups who are here with us today. Students, we're very pleased to have you here today. We are counting on you to be the leaders of the next generation on these important challenges. Now, it's my great pleasure to introduce for the first panel someone who has been extremely supportive not only of our programming on women and global development, but on so many other issues on the world. Please join me in welcoming Mimi Frankel to the stage.
Good morning. Thank you for joining us for the 4th Annual Global Health Symposium. We're pleased that the symposium continues to grow and attracts such a wide audience each year. I'm pleased to be introducing this morning's opening panel, which will explore the important relationship between health and childhood education. We're now in an era where innovative ideas and technologies can change the way healthcare operates in marginalized communities. Wearables, mobile technology, new methods of education, and a greater understanding of childhood brain development are creating incredible opportunities for real change locally and internationally. However, the stakes remain high as this new era still has to contend with an international system that continues to leave countless children without access to these innovations and even basic health care. Today, we will hear about some of the exciting initiatives that are working towards linking education and health. And we will also understand the challenges and opportunities around implementing these innovative initiatives and how they can reach the most marginalized children globally. You have a full copy of our speakers' bios in your brochure, but let me briefly highlight a few of their achievements. Caryl Stern, she is the president and CEO of the U.S. Fund for UNICEF, and she serves on the boards of the Container Store, the We Are Family Foundation, the Center for Disaster Philanthropy, Seeds Academy, and, listen to this one, the advisory board to the Women's National Basketball Association. Our next panelist is Dana Suskind. Dana is a professor of surgery and pediatrics at the University of Chicago Medicine Comer Children's Hospital. She directs the Pediatric Hearing Loss and Cochlear Implant Program, and she is the founder and director of the 30 Million Words Initiative. I'm anxious to hear about that. I'm not familiar with that one. Our next panelist is Rebecca Winthrop. Rebecca is a senior fellow and director of the Center for Universal Education at the Brookings Institution. She was the former head of education for the International Rescue Committee and has worked on the UN Secretary General's Global Education First Initiative, Michelle Obama's Let Girls Learn initiative, and the Clinton Global Initiative. And finally, our moderator is Tony Raden. Tony is the Senior Vice President of Research and Policy Initiatives for the Ounce of Prevention Fund. Please join me in welcoming our panelists and moderator to the Council on Global Affairs.
Well, hello everyone. Thank you. Thank you, Mimi, for that lovely introduction. And hi, I'm Tony Raden. I'm from the Ounce of Prevention. It's really a pleasure to be with everyone today. And I really want to thank the Chicago Council on Global Affairs for convening this terrific symposium, but even more for their sustained and creative leadership on global health. Very quickly, for those of you who are less familiar with the Ounce of Prevention, the mission of our organization is to give children in poverty the best chance for success in school and life by advocating and providing the highest quality early childhood education for children birth to age 5. We do this through an integrated focus on program implementation and innovation, local, state, and national advocacy and policy work, and on research. But part of why I'm so excited to be part of today's discussion on childhood education and health is that it's such an important emphasis of the work of the Ounce. And we know that science shows conclusively that the foundations of health that all children need to thrive are fundamentally linked to the educational opportunities provided to them. But according to the World Bank, across the world, nearly half of all children ages 3 to 6 are deprived of access to pre-primary education, and 1/4 of all children worldwide under age 5, that's over 162 million children, are physically stunted, which is harming their neurological development. So the challenges we face are immense and extraordinarily complex. And we know that to dramatically change the developmental trajectories and life chances of poor or marginalized children growing up in conditions that place them at risk of failing to reach their potential, there's an urgent need for new, innovative, and holistic approaches that integrate learning and development and that can reach kids and be scaled effectively and efficiently in the US and globally. And so that's the topic of today's discussion. And we're honored to have with us 3 leaders who are truly on the cutting edge of innovative and effective work for children. So I'd just like Rebecca, Dana, and Caryl to quickly introduce themselves.
Hi, I'm Rebecca Winthrop. I run a center, as Mimi said, at the Brookings Institution that focuses on education in the developing world. I've come at this very initially, starting 20 years ago, from looking at women and girls' empowerment. And I've been focused on education and working on education in developing countries largely, across Africa and Asia, and various other places around the world. And it's a thrill to be here, and I've been really excited to learn a lot more about what the Council is doing, and really feel very lucky to be invited to share what we're working on.
Hey, Dana.
Hi, I'm Dana Suskind. I'm actually a pediatric cochlear implant surgeon who runs a research-based initiative at the University of Chicago called the 30 Million Words Initiative. And I think the fact that a surgeon is doing education research, I think is telling that education and health are inexplicably linked in the early years. The basis of the research that we do in the lab is really that early language environments, basically how and how much parents are talking and interacting with their children, play a foundational role in fundamental brain development and education and health trajectories. And our program is really about empowering all adults, all parents, really all mothers, to enrich their children's early language environment through a public health initiative.
Good morning. I'm Caryl Stern, the President and CEO of the U.S. Fund for UNICEF, and our organization has kind of a tripartite mission, the first of which is fundraising and raising the dollars that support the work of UNICEF in 190 countries and territories, but also secondarily to be the voice of children from around the world. So I spend about a third of my time in the field with UNICEF, bearing witness and coming back to try to get that voice out across the country. And then finally, to raise a generation that will hopefully do a better job than we have in meeting the challenges that we see around the world. And so that's about education programs here in the United States.
Okay, thank you. Okay, well, let's jump in. So, Rebecca, I'm looking for you to kick this off. Based on your research and extensive work around the world to expand educational opportunities for children, can you talk about some of the ways that you've come to understand that health and education are so directly linked?
Yes, happy to. So the way I see it, health and education are basically the two fundamental pillars of human development, basically in any country in the world. And the connections go both ways. I mean, I think you just talked about how important health is for child development, and there's a huge amount of literature and information out there that Dana and Tony and others would be better to talk about than me, but you know, if kids are stunted, meaning they don't have enough food, they don't have the right nutrition, here in the US, their grades and learning levels are much lower. And that happens here in the US in really poor communities, I would say in this city, in poor communities, as well as around the world. There's a lot of ways in which if you have ill health, you do very poorly in education. One of the big problems in developing countries in certain regions is young kids get a lot of intestinal worms. These are very yucky. You never want it. They just get it from drinking normal water, and it's very debilitating to kids' health. And very cheap sort of interventions that get rid of these intestinal worms. There's a movement called deworming. Immediately has massive impacts on kids' educational outcomes. They attend school much more frequently, they have higher wage earnings. So there's a lot of ways in which health improves education. But it's also true the other way around, and that's the way education actually improves health is a way that is discussed less, I've found, amongst policymakers. I don't know if you guys would agree with me, you should jump in. But because I come at it from the education angle, one of the things that I've been struck by, and I recently did a big research project looking at girls' education in particular, and we find that girls' education, even more than boys' education, you should do it for the boys too, has a huge impact on children's health, mother's health, and the community's health. So for example, if girls get a secondary education, it is the biggest driver of getting kids immunized, even more than how much money, what social status they have. Another example, since 1970, half of all the reductions of infant mortality, so babies dying before the age of 5, is directly attributable to girls getting higher levels of education. So the message is that actually education in some ways can be seen as a health intervention, and equally in many ways as important as health interventions for getting improved health outcomes. In the HIV/AIDS community, people talk about girls' education as a social vaccine. And it's true, actually, that the evidence is so stark that the higher levels of education girls have, the massive reduction in HIV/AIDS infection, equal to sort of medical interventions. You need both. So that's incredibly important. The other thing that I think is incredibly important to point out, and I think it's important actually because both Dana and Caryl are working on projects that are really doing this, is that education is really one of the unique social change levers that we have for changing people's mindsets about life, about what a community means, about what it means to be a good global citizen. One of the things that we do a lot of at my center, at the Brookings Institution, in our work, is really trying to think about what are the skills and competencies young kids need, girls and boys, to be successful today and in the future, because the world is rapidly changing. And we know young kids need important things like literacy and numeracy. And that's a huge problem. There's 250 million kids around the world, the vast majority who've been in school for over 4 years and cannot read. So that's terrible. But we also know that young kids need to think about critical thinking. This is becoming increasingly important for my kids who are little, where education used to be based on a premise of a lack of information. You had to memorize it all because you didn't have enough of it. Now we're overloaded with information with the web and the internet, and what our kids need is to think about what not to pay attention to, what is trustworthy. And that's something that's equally important for kids who are subject to radicalization in other parts of the world, as are kids here. Kids also need to, I would argue, to think about what it means to be a global citizen. We're an increasingly interconnected world. What does it mean to live in an interconnected world where what I do impacts other kids? So this mindset shift, including also what does it mean to be healthy and what are healthy behaviors? That's a piece of it. Is that okay?
That's terrific. Wow, that's just a wonderful opening frame for this discussion. So Caryl, I'd love to pass this to you. I know the audience would love to hear about UNICEF's exciting new Kid Power Band initiative.
And before I do, I'll do the commercial that Rebecca did not do. Do not wait for the movie, buy her book.
Oh,
Hold
I
your
meant to
book
do
up.
this. Sorry.
Thanks, Caryl.
Rebecca just co-authored this wonderful new book on girls' education. It's a terrific read. I read it over the last 2 days. This is destined to be on syllabi around the world. And
Okay, now I can tell you about the project. Okay. You know, as part of my job every day, there's a series of reports that land on my desk from a number of associations represented in the room, but in particular from the United Nations. And there's a joke in my office about if we read 1/10, imagine how powerful we could be. So I try really hard, though, to kind of dole them out and make sure somebody reads all of them. And inevitably, there's a stack of reports on my desk. And on a particular morning about a year and a half ago, I walked in and there were, purely coincidentally, 2 reports side by side. And the first one said that 1 in 4 children in America is underactive to the point of contributing to the significant obesity problem we have in this country. And it was an interesting report that discussed that a number of us are looking at what we put in our mouths, but not enough of us are looking at how we might teach our children to be active enough to overcome what they're putting in their mouths. And it was an interesting report. And right next to it, though, was a second report that was that 1 in 4 children around the world are severely malnourished, meaning if there's no intervention, they will die. 1 in 4 around the world. Today, as we sit here, 16,000 children will die today of causes we know how to prevent, all under the age of 5. And just, we're not getting there in time. But I was struck by the 1 in 4 around the world severely malnourished, while 1 in 4 in America is sitting on the couch. And so I turned to my senior management team and I challenged them to come back with something that would take what we're wasting here and convert it into something that could save the 1 in 4. And they came back with a program that is now known as Kid Power, and we actually did the public launch of it here in Chicago yesterday at Budlong Elementary School. But the program started with a pilot in the city of Sacramento shortly thereafter. We've created the first wearable for good and for kids. It's aimed at 3rd, 4th, and 5th graders. It is not a $150 item that one might purchase. It is a low-cost wearable for good. The school-based program, and there is a school-based program and there's a family program. But let me tell you about the school-based program first. Children in 3rd, 4th, and 5th grade are given the bands. They're not asked to purchase them. We give them free in schools where 85% or more of the children have been identified as being on some kind of a food sustenance program themselves. So either the family is on food stamps or they are on breakfast at school or hot lunch at school, some kind of food sustenance program. The teacher in the classroom is given a tablet that is preloaded with information about children around the world, as well as nutrition and activity. And the kids are challenged to meet the minimum number of daily recommended steps. For every 1,500 steps that they walk, they earn a Kid Power point. And I have to tell you, it lights up and it buzzes. If it happens while I'm here, you will know. It's exciting even as an adult when it happens, but the kids really like that part of it. It lights up, it buzzes, and they earn a Kid Power point. And for every 10 Kid Power points they earn, we release a sachet of micronutrients to a starving child. So the motivation to the American child is, if you get healthy and walk your steps, you will save the life of a child elsewhere. We challenge them in a Kid Power Month. For those of you who are medical professionals, you know that micronutrients, a normal routine is 3 to 4 weeks. So we ask the kids to meet those steps for 4 weeks. The class is given a class goal. They swipe their bands on the tablet every day anonymously. No child knows what any other child has done, but the class gets to meet the goal, and then they get to celebrate. There's also a leaderboard. They know how all the other classes in their school are doing. They know how all the other schools in the city are doing, and by the end of this month, they will also know how the other cities are doing. There's a series of prizes and competitions that take place, and we've been very well supported by the NBA and other sports leagues in providing prizes and different kinds of fun things for the kids who are participating. But the challenge was, how do we make it really exciting? And how do we get the rest of America involved? Because the gauntlet I laid down for my team is 1 million American kids, saving the lives of 1 million kids around the world. And we literally cold called 2 partners, one of which is now Target, where starting in May, you will be able to purchase it. You could purchase it during the Christmas season, but in all candor, it sold out in 4 hours, so we had to now wait for a lot of reproduction that we didn't anticipate. But it is a $39.99 band, $10 of which goes automatically to micronutrients. The parent who purchases the band gets a password to a protected app. And on the app, there are family missions that provide what a teacher might do in the classroom, but provides it so that a child can do it at home. Each mission is led by a prominent, well-known athlete, and each mission focuses on another part of the world. So your child is learning about the world, he's learning about health, he's learning about activity, and he's learning about philanthropy all at once. And then the second partner that came on board, and again, it was somewhat of a cold call and really exciting, is Star Wars is our partner, Lucasfilms and Disney. It is the Force for Change project. So they not only come in UNICEF blue, obviously a color I'm a little partial to, but they also come for the dark side in black and for the light side in white, and they say Star Wars on them. Those are the ones that sold out in 4 hours. And Pink, the singer, came to the table. She is the national spokesperson on the project, as is Tyson Chandler from the NBA and a number of other NBA players. But what has been really exciting about it, and we saw it at Budlong yesterday, is how excited the kids are. We did a study on the program. We had a control group who got the bands, and it was a classroom experience just to get healthy. And then we did the other group, which got the bands and the project of You Will Save a Life. And we found that the kids who were motivated by saving a life were 48% more active than the children who were not, showing that 3rd, 4th, and 5th graders are more motivated by altruism than they are by health, and because they don't see themselves as anything but fearless at that age. I have great footage of these kids in different schools around the country running through the hallways screaming, "I'm saving a life." I mean, it's really remarkable. The young man we interviewed at Budlong yesterday, and I shared this with some of you last night, we asked him why he liked the program, and he looked right into the camera and he said, "Well, I used to not be such a nice person." He said, "And this is making me a nice person." And I loved it. But the other piece that's been very heartening in the school program is, because the majority of kids are on a food sustenance program themselves, I have an entire box of letters now from moms and from the kids themselves who are telling me that they've never had the opportunity to give before. They've always been the get, and how empowering it is to be the give. I think that's the lesson that as adults we can all learn from this project, and I think it's really powerful when you hear it from young people. And I have 3 of our young ambassadors in the room, and I'm just going to take a minute, if you'll allow me to stand up, please, gentlemen, and be recognized. Oh, I have more than 3. Forgive me. I didn't see you guys. I only saw the others. There are more. Ladies, you should stand up too. So that's the project. It's get healthy, save lives.
Great, thank you. And this is one I can personally vouch for. I just told Caryl I was one of those lucky parents who somehow made it in that 4-hour window last year and was able to get 2 of the Star Wars bands for my 8 and 6-year-old. And it is indeed motivating and inspiring, so well done. Okay, Dana, let's turn to you. The 30 million words model has become extremely influential in the early childhood field, and in many ways is sparking a movement around early language and parent talk. Can you talk a little bit more about your model and a little bit about the nexus between learning and health?
Absolutely. So I think just to put it in context, my work, despite being from the world of health, appears to be all about early learning. But as we've talked over and over again, early learning is about health and education. To give a little context about the name, it really comes from a study that was the 30 Million Words Initiative. It comes from a study that was done probably 30 years ago, which demonstrated that by the end of the age of 3, children born into poverty will have heard 30 million fewer words than their more affluent peers. And just this difference in not just the number of words, but the quality of words, really the language interaction, plays a foundational role in the educational trajectories of children. Really, the achievement gap as we know it today, the roots start in the first 3 years of life. And that's really the focus of my work and really everyone in the early childhood field, that it's not just about education, it's about brain development. And really what we're trying to do at the 30 Million Words Initiative is put language, early language environments, as right at the center of what we consider the most important social determinant of education and health. Because if we can strengthen the early language environments of children, we can really change their trajectories. What are we doing? The 30 Million Words Initiative is actually just a research program. We're very much about the science of trying to understand how to develop programs that really partners with parents, parents who are the critical factors, really the architects of their children's brains, to allow them to, number one, understand the science, and number two, to enrich their children's early language environments. We take a distinctly public health approach to what appears to be an educational issue, because this is a population health issue. We use maternity wards, pediatricians' offices, home visits, early learning centers, to be able to work with parents and caregivers, meeting them where they are. We have a number of different intervention programs that, number one, marry health and technology. So I loved what Caryl was talking about, that you can count the number of steps. But just imagine if parents could start counting the number of words and conversations that they had with their children. And that's what they can do with our program and a number of other programs. Number one, parents first understand children's language, brain development, and understanding that children aren't born smart, they're made smart. And after they understand that, they then are allowed to understand different strategies, just normal everyday strategies, whether they're changing their baby's diapers or going to on the Metra, to enrich their children's language environment. And at the same time, they use something called the Lena, which is like a language pedometer. The child can wear it for about 16 hours, and it counts the number of words they're exposed to, how many conversations, even how much television is in their world. And parents can then start understanding in a concrete way what their language input looks like. And they begin to goal set. They become very competitive with each other. They start showing their family members, and they begin to understand just truly what the science shows, that they are the most powerful people in building their children's brains. Our long-term vision is really a population level shift, where all parents, really all adults in this country, understand the power of the first 3 years of life and the power of language in building children's brains. Because if we can move that needle as a nation, we can truly, and as a world, we can truly start preventing the achievement gap rather than remediating it. And that's really what our program is. But we are a research-based program working and hopefully partnering with people like you to get these programs out. And of course, ounce of prevention.
Thank you. Okay, so Caryl and Dana, let's continue a little bit and talk about implementation. What are you learning about implementation, and what are some of the challenges and barriers you're facing, as well as the opportunities?
Well, I think one of the things, as I said, we hadn't factored was the power that the kids themselves would bring to the program. How many ideas they come up with and how that has enhanced the program. So now we've built in the mechanism that allows us to share their ideas. We've also learned how important it is for it to be a two-way program. It isn't enough for us to provide the project. There has to be a way to receive the response to the project and then to promote that response. The interactivity has to be at that very granular level, and I think, again, something we hadn't anticipated. We have affirmed how powerful the use of a sports figure is, testing celebrity versus sports figures. Sports figures test better in terms of resonating with kids, and so it's been really kind of interesting, just a kind of a little piece of data. We also learned that it is a health initiative. And this was one of the challenges when we were first trying to figure out how many to produce. Because we took this to every major company. Nobody wanted to produce it. So we produced it ourselves. I mean, we started a little mini startup within the US Fund for UNICEF of 9 people. And they actually found the manufacturer, designed it, did the whole thing with another organization called Calorie Cloud, who had the concept. And really, we couldn't have done without them. But when we first were selling it into the store, and none of us are in the for-profit industry, we know nothing about selling a product, and we were very thankful to have Target as our partner. They were conceptualizing it as a fitness band, and Fitbit owns that market, and we purchased and manufactured the number proportionate to what the market share would bring, knowing they own the market. And only afterwards did we really affirm that mom is not walking or dad into the store to buy a fitness band and finding this and saying, oh, maybe I'll buy that. Mom or dad is coming in to buy this. And so it's not a fitness band, it is a health and education project with your child, and it's a philanthropic project with your child, and we don't have to compete with the big kids, we're something different. And that's why it sold out in 4 hours. I mean, it was unbelievable, 40,000 bands in 4 hours. And so it will be in 180 Target stores in May across the country, in a very prominent space this time. And we're hoping it sells out in 4 hours again, so.
So I think about implementation in a different way. Our programs are being designed to map onto sort of the public health infrastructures, maternity wards, pediatricians' offices, home visiting programs, which are policy-driven. And so implementation, which is really how do you take these programs that you develop in the lab, working with communities, but you have a lot of control, and how do you allow them to scale up, go nationwide, and still be effective? And it sounds really simple, but it is probably one of the most difficult aspects of this work. And it deserves the same rigorous science, and it's actually where we are in terms of our program thinking. All of our programs have been developed with an eye to scalability. All of our programs are technology-based, so on web platforms with animation and real video, but humans implementing them. And so the next step is the implementation science, partnering with communities and state and local governments in trying to figure this out. And we will let you know in a few years how it goes. But I think that it's really important to understand that social policies too often don't have evidence behind them or driving them. And that's shifting now in the last few administrations. menstruation cycles, hopefully. And that's really what we're doing. We're developing programs that can continue to feed back data to policymakers so that they know what works and what doesn't work and can iterate accordingly.
Great, thank you. Rebecca, it's notable that both of these exciting initiatives, which are being implemented in the US, are harnessing technology in innovative ways. And you've done a lot of writing and research about the potential of technology to really advance education and learning in the developing world. So my question for you, based on what you've just heard, can models like these that are implemented with relatively cheap technologies be effective in reaching children in marginalized communities in some of the poorer regions of the world?
It's a really good question, and I will answer it. But first, first, I just want to say that not only am I going to go to my kids' school and tell them we need to do Carol's program, I predict here that that band is going to sort of disrupt the Fitbit market. I mean, I would wear that. I'm not sure I would wear a Fitbit. I think it's much cuter.
And you can throw it at your brother and it doesn't break.
Really?
Yeah, it's kid tested.
Yeah, so even better. So just, here and now, wow, we predict
That's
big,
another
heavy,
thing I can
big,
vouch
heavy
for, too.
revenue stream for UNICEF, going to take over the Fitbit market. Not that I'm not against Fitbit. I think they're a good company, but I can just see the tweets now. Technology, the developing world. So one of the things, actually, we were talking about this earlier when we chatted about this panel. I think actually technology, two things about technology in the developing world when it comes to education and sort of thinking about scale and disruption and new models. One is that in reality, until now, the history of how technology has been useful for education in the developing world is pretty crap. And that's a scientific term, pretty crap, meaning it's had very little impact. It's not to say that there aren't good pieces of examples, but by and large, the approach has been, I have a great tool, I have a desktop computer or this or that, and I'm going to go and search for an educational problem that this can solve. And that, we've learned, is the absolute wrong way to deploy technology. Really what has to happen is people on the ground in the developing world need to say, gosh, I have an intransigent problem. It's not being solved. What are the tools that could help me? And if technology is a tool that could help, and it could be very easy to use and sustainable, because that's been a big problem with past technology interventions. I can't tell you how many schools, and I'm sure you've seen it too, Caryl, how many schools I've been in the developing world where you say, what's that little box of stuff in the corner? And you lift up a little sheet and there's a bunch of old broken desktop computers. And they say, oh yeah, someone donated it. And then, the keyboard broke and nobody knows how to fix it and the teacher doesn't know how to use it, and that was the end of that. So we know that approach doesn't work. But I do think that mobile technology, and frankly, harnessing how the developing world is innovating with technology all the time. It's less about, I spend some time with technology people and talking about education in Silicon Valley every once in a while. And my message to them is like, look, it's less about you guys finding a solution in your part of Northern California and going forth and scattering it around the globe, than bringing your smarts and your brain, which there are many in that part of California, to partner with people in the developing world about how technology can best be harnessed. I think we are possibly on the cusp of finding new ways, particularly with mobiles, particularly with open and free content online. That's revolutionary for education, for really opening up sort of how knowledge can be accessed, who can access ongoing learning and information. Africa basically did a big leapfrog in the telecom space. There was no landlines. Africa did not invest in laying landlines. They skipped straight to mobiles. And as a result, they're doing lots of creative things with mobile phones. I mean, mobile banking is so much farther ahead in Kenya than it is in the United States. And so we have the same potential to look at that for education. There's this group, right now one of the research projects we're doing at Brookings is scanning the landscape for innovative models of how education can be delivered to marginalized communities and to the developing world writ large. And technology seems to be a big piece of it. And there's a lot of stuff happening in little bits and pieces around the developing world. I'll give one example. There's a great group called World Reader, which basically is providing libraries and books with e-readers rather than which is much more expensive, sort of book publishing and taking trucks and distributing them around to schools or libraries. It's through tablets, and there's so much free online content. The other thing that they do, which is very important, is they partner with local language publishing. So they're helping build a market in country for local language publishing. And the number one book that is downloaded and is can you guys guess? Take a moment, think, what is the number one book that young kids, adolescents, young kids across Africa and developing world, what? Harry Potter, she said.
Is it Harry Potter?
No, How to Use a Condom. And girls are accessing this type of, are reading 6 times more than boys on e-readers. So it is really amazing the type of access to knowledge that can be opened up through technology.
And that's probably, you know, I was going to say to you that I think the biggest health technology thing I've seen in the developing world is all around the HIV issues. Because when the stigmas were so loud that you couldn't ask the questions you wanted to ask as a young person, things like child-to-child radio in Africa, where kids could actually call in anonymously and ask a question, you would find kids huddled around the one radio in a village when that program was on. And now that's morphed into chat rooms and places where they can go for information. Similarly, I remember being all the way up on the Amazon with a young man who was HIV positive about 8 years ago, and he was in a village where no one there even knew he was HIV positive, and his only access to any kind of a support group was an online group. And his mother used to skip a meal to save the money for this child to take a boat ride up the river to a village where there was a computer so he could access this chat room. But on the other end of the spectrum, something that you were saying, Dana, was one of the best ECD, early childhood things I've seen is in Ethiopia, where they take the reward for being a child who's 12 or 13 in the one region in Ethiopia for staying in school is you get to be a peer teacher. And this is a very respected opportunity, and they're not paid, it's volunteer. And the peer teacher is assigned 2 or 3 kids who are 3 and 4 years old. And they're given a little bag that has different colored stones in it. And that's the entire teaching kit. And what the peer teacher does is teaches the 3 and 4-year-old how to count and and what colors are, the words for colors. Because the studies had shown that these kids who, if they were making it to school, were so far behind. So it's like the mini Head Start program, and it costs $7 per child, I think, at the end of the time to train these peers and to actually get them into the villages with these kids. And now the study has shown that the kids who have experienced being taught by a peer trainer, over 90% stay in school past the 12-year mark.
That's amazing. I think that really goes to show that education ultimately can be free. I mean, technology is so important to harness and stimulate, but at the end of the day, the human brain is wired through interaction and colored stones.
Mm-hmm. So. Terrific. Wow, this is such a terrific discussion. In the couple moments that we have left, I'd love to talk just a little bit more about scaling, which each of you have mentioned in your comments. Rebecca, I know you're doing a lot of thinking and writing about this. Could you share a little bit of what you've been learning, and in particular, how you're thinking about how to scale learning?
Mm-hmm. So I agree totally with Dana that we have spent, at least in the education sector, a lot of time, rightly so, trying to figure out what works. And that is 50% of the answer to the problem we have. The other problem is how do you scale it up? Because we have lots and lots of wonderful pilots that are really important, but aren't reaching huge numbers. So we're doing an initiative. A colleague of mine on my team named Jenny Perlman Robinson and I are leading this initiative called Millions Learning, and it really is looking at the process of scaling. So at Brookings, we spend a lot of time working with ministers of education around the world, global policymakers, and their questions will be, well, what should I do? What is effective? And can I scale it up? And how do I scale it up? So there's a lot less knowledge about can I scale it and how do you scale? So there's a couple of things we're learning about the science of scaling up. And there is an initial sort of group of people out there who are looking at the science of scaling. One is that although a lot of people focus on the technical solution, how do you craft this program? What is the how do you make the Fitbit? How do the pieces fit together? Scaling up is 50% technical and 50% political. And people forget about the political part. So anytime you want to do social change, do things differently, there's going to be losers, people who stand to lose in some way, shape, or form. So you need to do that political analysis early, bring them in, find a way to make it beneficial for them. So that's one thing. Another thing that we're learning, because we've actually done a lot of deep dive case studies around the world, including in the Amazon and Brazil, so I know exactly what you're talking about. And they're doing some of the most innovative work on technology and scaling education, actually. But another thing that we've learned about scaling up is that when you have a really effective, good program, a lot of times people design the program that is in a way that it just won't scale. It is too expensive per child. It's kind of like the gold-plated model. It has lots of little different nuances and lots of little high-touch things. So it's too complex and it's too expensive per child. So never could a government sort of take it up and be scaled. So programs have to think about scaling right from the beginning when they're sitting in designing it. So that's incredibly important. And the other thing that they have to do, we've learned when you go out to scale an effective program, is you have to strike this intermediate balance, and we start calling it flexible adaptation, which is you don't take exactly everything that the program is doing and try to replicate it. That's very costly. You have to deploy people from your team to train them on to do exactly what you did. It's kind of a cookie cutter model. It doesn't work. Nor do you just sort of be laissez-faire, and do whatever you want, because then people try to replicate, but there's a big problem of replication without fidelity. It doesn't have the same quality. So you have to identify what are your core ingredients, what are your top 3, 4, 5 things that make your program effective, and what are the others that can be adapted to the context. So it might not look the same the way learning is delivered in the Amazon as the way learning is delivered in India or in parts of Washington, D.C., but you could have similar core elements which have to do with teacher-child interaction, have to do high expectations, allowing kids to develop a diverse set of competencies. Those are all things we know work really well in learning. So those are some examples.
So briefly, Caryl and Dana, how are we going to get to the population level change that you're seeking?
Well, as I said, we set a goal. The gauntlet is 1 million. We started last year at this time. We had 10,000 students in the program. The original pilot was 1,000. We scaled to 10. As of this month, we will have 70,000 students in 13 cities in the pilot. We will have over 140,000 people who will do the band through the Target Purchase Project. And our goal is to continue to replicate that, but I could not agree with Rebecca more. It has a local component. The lesson plans get aligned with each state so that they're applicable and appropriate and easy for teachers to use, constant adaptation, the way a city wants to introduce it, who's involved in it, what are the rewards, all of that happens at the local level, and it has to have local champions, or it doesn't have any depth of meaning for it. So we're trying very hard to make every child in the program feel like they're part of this national movement of 1 million, but at the same time, they are a champion in their community, in their classroom, in their home. So it's the meeting of both ends of that.
I think the reason that I was asked to be on this panel so I could be next to Rebecca, since that's the next step of our program. I think that going back to what Rebecca said, understanding what the core ingredients of your program is before you're scaling, understanding that you need to have something that, not only responds, that not only impacts policy, but responds to policy. I mean, it'd be great if every child could get exactly what they deserve financially and families. But so our programs are developing prospectively, figuring out those core ingredients so that we can scale. Our technology is built for scaling, and really we're meeting afterwards to discuss how we're going to scale this nationwide, so we'll let you know.
Great. So I know we want to leave a couple minutes for the audience to be able to ask some questions. So Jeff.
Absolutely. Thank you to the panel for a wonderful start to the day. My name is John Macca. I'm Director of Public Programs at the Council, and in each of our panels today, we'll turn it out for a couple of questions from you. So keep those questions kind of rolling throughout the day. Raise your arm if you have a question. We have microphones around the room, and I'll get someone over to you. And I see right here in the front, we have Dave Johnson. We'll start with you.
Wow, that was really terrific. I'd say implicit in all of your remarks is a faith in bottom-up, evolutionary, organic, almost market-driven change. And I see nodding, so I'm going to assume that's true. So I just wonder how you think about the balance between that kind of bottom-up change and the top-down change, which lots of people focus on, and how do you get that right?
I think we had kind of an interesting conversation about that last night with regard to a different issue, but I think really sustained change has to be primarily bottom-up, because if the masses don't want to see the change, top-down isn't going to make it happen. I think the evolution process, when you talk about scale, is critical. I can even tell you, for example, with our band, we have already created the program so that it's band agnostic, so you can do it off your smartphone. It's got to be easily accessible. But at the same time that we are rolling this out, I talked about the pilot. We went to Sacramento originally because we knew the mayor. And when we come into a community, we are not just going directly to the principal in a school and saying, do you want to do this? We're going to the Board of Ed, we're going to the mayor, we're going to the governor, we're in the White House, we're talking to people about how do we make health of our children a priority, but empower children to take that responsibility on. So it's got to be a meet in the middle.
Yeah, I couldn't agree more. I mean, I think it's a combination of top-down and bottom-up. I mean, when you think about behavior change, I think of some of the successful initiatives, tobacco. And that really, it took a multifaceted approach that eventually there was a tipping point. Obviously, we haven't completely ceased. And in the same way, we're looking at this issue in the same way, with different dosages, a population-level dose, so places like Too Small to Fail and Vroom, who are really getting this idea out nationally, community level, which is what we're doing, working with healthcare organizations, faith-based, center-based, and individual level, home visiting. But really my favorite part of our program is something that we call Spread the Words, where parents become not just agents of change with their own children, but agents of change in their community. And we actually trace out, in collaboration, their social network, their family, their community, and then they actively begin spreading this message. And it allows parents, in the same way as these kids who often society has said, you have no power, and really allows them to see how powerful they are with their own children and in their community. So I think it's a combination.
I think it's actually a really good question, and you're right that the government policy change piece didn't come out as strongly in this discussion, but it is crucial. And I know all of our, actually starting with Tony, all of our organizations work heavily on that piece. But one of the interesting insights that we've learned from this Millions Learning initiative, where we went around and did deep dives on where has scaling worked. Where has scaling improvements in quality learning worked around the world, and what can we learn from those successful examples? There were a couple of things on your question. One is that very few cases can education systems reform themselves from the center top within, sadly. But governments do play a pivotal role, and they play a pivotal role have been in a couple of ways. One, that they allow space, whether it's allowing a state government, like the Brazilian National federal government allowed the state government of Amazonas, where a lot of kids are trying to get educated in the Amazon jungle, and it's very hard, to try a totally different model of delivering schools. So they can allow their own, within the government system to sort of have a space for innovation, or allow space for civil society or private sector to really try new models. And so government is crucial for that. Allowing spaces really on the margins, of an education system or on the margins of an ecosystem. And then the second thing is for really trying to see the data that's coming out, and then being willing to partner to try to help scale it up more broadly. So it's a different model than just just change your policy and everything will be fine. A lot of that's not to say it's not worthy. It just hasn't been that effective, at least in the developing world.
All right, let's try to get another question in. See anyone yet? I know it's kind of early. Yeah, right here in the center. Thank you.
Hi. First of all, the panel was fantastic, and the work you're doing, you should just all be commended. My question actually is around the technology. I do work in healthcare, and we know that the manufacturing of a lot of these technologies occurs in the developing world, and the risks that are posed to the health of the women and their unborn children manufacturing it, and also the recycling of the technologies that are being developed. Are any of you partnering or working with folks on what you do with the technology when it breaks or becomes obsolete?
So on the front end, the UN is part of the Global Compact, which requires work standards to be adhered to. And it actually speaks to your question as well, because we've seen what happened, for example, in the rug industry when the UN took it on and said, okay, we've got to attack it from all different angles, and we've got to get stores to say they'll only purchase rugs to sell from safe factories. And so in order to do that, how do they know the factory's safe? Well, we have to go in and certify the factory. Well, what are you going to certify them for? And create that criteria, create a rug mark, and we changed the rug industry. When we made the commitment to do the startup, we want to boost the economy in the developing world. So, we clearly looked for places where the products could be made, but we had to ensure that all of the appropriate global compact things were going to be adhered to. So each piece of it is made in a place that has been certified, and we will continue that no matter how large it grows. The recyclable was one of the reasons we started to look at how do we make this device agnostic, and it also builds on what we were talking about. The developing world went straight to mobile. And we have found in terms of getting health messaging, SMS messaging has become a lifesaver for a woman who is in labor in a place where there's no doctor. So we are looking at ways that will ultimately make it not device dependable. But while we were doing that, we learned from our kids how much the band mattered. They wanted to wear the bracelet. It's like the Livestrong bracelet. So we have played with different kinds of things. We've not yet solved the problem entirely. But it is on our agenda. We're looking at it every day.
Okay. We can do one quick one. We'll do right here in the center. Microphone's coming to you. Yep, almost there.
Hi, thank you very much. This is an amazing example, I think, of what you would call a first-generation tool that is probably going to impact a lot of people. And I'm going to focus on the relationship between the child and the other child in Africa. And I'm wondering if you've thought about, and I work with college students, so one of the things we do as they engage in global work is to try to deconstruct sort of a savior complex and think about a companion partner complex. So when we project that relationship back, is there a way to think about including these voices and a more complex awareness for the child? I also wonder, because my children would do this, and they're very wired, to the reality of it. Could there be some guilt and, anxiety if you don't do your share because you're letting a kid die, basically? You've set up a very causal relationship, and kids are very concrete thinkers. And then third part of the question, you see how it's all related. I know this is not a surprising question to you. Were there any African voices involved in the design in terms of thinking about this aspect of it? How are we framing the relationship for young people that we want to be partners for change in the future and help each other without that I save you part?
So first of all, it's not a one-to-one. We never do a one-to-one specifically for the reasons that you're stating. So it isn't, here's the child I'm saving. It is, if you get active, you will save lives, okay? That's number one. Number two, the presentation on the missions. UNICEF works in 190 countries and territories. More than 50% of our teams in all of those countries are local. That's one of the things we are very, very adhered to. So the missions are being developed by the country offices, not by the U.S. team. They are dictating and mandating the content. And it is not a poor me, look at me, I have a problem mission. It is, I'm a kid and I play ball too. It is, look at what I do to get water, but look at how strong my arms are because I do that. It is, let me teach you the dance we do in our village. So it is a partnered approach. It's not a pity me at all in the missions because we as an organization are committed to ensuring that we never present the child as a point of pity. And it's interesting. The guilt question, you know, I haven't seen it yet. As I said, we're 10,000 kids in the original pilot. I've yet to see a kid who says, oh my God, I let them down. That doesn't mean it doesn't exist. You're probably right that it might. The classroom program, I feel pretty confident it's being protected because that's why no one knows who has and who hasn't, and no one is embarrassed. We've had actually a converse reaction though. A lot of the girls in the program in particular have reported, because we did have an external evaluator and I read all the comments, they don't participate in gym because they don't feel adept. You know, they're not athletic, maybe they're a little overweight, or they're just not comfortable in their gym shorts, it's culturally not comfortable, whatever, they don't like to take gym class. This doesn't dictate how you get active. It just says walk. And so, you know, I was sharing last night some letters for moms about, you know, my kid makes me get off the subway in New York now one stop before the school because she has to get her steps in before class. Thanks a lot, I'm losing a half hour of sleep. You know, I'm getting those kinds of letters. Or pictures of kids walking around the dining room table. It doesn't require that you have to be a great athlete. And so it's actually conversely empowered people to get active.
Unfortunately, that is all the time we have for this first panel, so please join me in thanking them for a great start to the day. Thank you. Please do stay seated, though. We're going to transition to the next panel right away. Just bear with us for a moment. While we're doing that, let me talk through the day a little bit. So we're going to have one more panel up here. It'll be about 45 or 50 minutes. Then we're going to transition back to the second floor, where you choose whichever breakout session you'd like to go to. You can use the elevator or the stairs if you want to get your steps in. Join our partners, meet them, have some coffee. Following the two breakout sessions, we'll reconvene here for lunch. Thank you. If there's one thing the council's known for, it's keeping the trains running on time. And we are 30 seconds away from being late. Okay, we're ready for the next panel. So please join me in welcoming to the stage Arati Gowda, the Associate Director at Skidmore, Owings & Merrill, who will welcome the panel.
Well, that was an amazing start to the day. I think we can all agree on that. I need to get one of those bands now. I think everyone does. So good morning. My name is Arthi Gowda. I'm an associate director with Skidmore, Owings, and Merrill. That's right up the street, where I lead a small group of design professionals looking at high-performance design in the built environment. So everyone enjoyed the first panel. That was great. As you know, we're now going into a weighty topic. Violence threatens women and girls all over the world, and they're at risk for everything from domestic abuse in the home to rape as a tactic for war. And I think that's hard for us to even say as a sentence in our safe bubble here, but very true. The complexity of gender-based violence makes it a problem where even incremental change is difficult. Coupled with a historic hesitancy to talk about many of these issues in a public setting, like we are today this morning, it's really no surprise that we're still discussing what could be very, very solvable issues. And there are many, many things that we know that can solve this. When invited to introduce our change agent speakers, I immediately asked myself how learning from these women, inspiring women, today could encourage my own engagement in this momentous conversation that we're going to have. As an architect, I was taught to design spaces that are defensible. In other words, those that allow community engagement and line of sight. It seems simple, but it's incredibly complex. So for an architect, that would be safety with eyes on the street. And the history of architecture is littered with beautiful buildings that are unsafe. And there are many examples of that even here in Chicago with our failed housing projects. And vulnerable populations there were victims to abuse in some ways because of the physical design of spaces. And I think if we all consider this in our own personal lives, everyone in this audience has their own story and how they could positively impact the safety of women and girls in our own communities. This is a complex problem that will take dialogue from all of us to improve, and so we're looking forward to the start of that again today. Our panelists would be talking today about sexual, reproductive, and mental health services that can best reach women in need. And they feature, excuse me for a moment, I lost my space. In any case, the speakers today have their bios on your chairs, but let me briefly highlight a few of the major accomplishments that they have made. Anna Blue is the Deputy Director of Girl Up, a campaign of the United Nations Foundations. Prior to joining the UN Foundation, she launched a strategic communications initiative and multi-million-dollar campaign for the Washington Jesuit Academy. Kristie Paskvan is the founder of Chicago Says No More. She's also the Chief Financial Officer of Mesro Financial in the city. And our moderator today is Cécile Shea. Cécile is the State Department Fellow of the Chicago Council on Global Affairs and has over 2 decades of experience as an American diplomat. Very impressive. Cécile will lead the conversation and Q&A on the stage, and please join me in welcoming this inspiring panelist and moderator today.
Well, thank you, everyone. Good morning. Welcome today to talk about this depressing and troubling, but perhaps by the end of this session, somewhat hopeful topic. I think all of us on the dais are very conscious of the fact that there are some very young people in the audience today, and we commend you for being here. But we realize that some of what we say may be difficult to understand or even upsetting. You should know that every adult in this room also finds this very difficult to understand and upsetting. But we hope, if you want, that you will take the opportunity to speak to some adults about what you hear today, either during the session or over the weekend or maybe next week with your teachers. I wanted to open with some words written by this lovely lady in orange sitting next to me, Kristie Paskvan. It is the welcome statement on her organization's website. And she writes, "Domestic violence and sexual assault thrive when people turn a blind eye, making excuses, not wanting to get involved. But now it's time. Please join me and other Chicagoans in saying no more." What we're going to do by way of introduction is first speak a little bit about the situation in the United States, and about what Chicago Says No More is doing, and then turn to a view of the problems of partner violence and sexual violence and assault in other parts of the world. In 2010, the Center for Disease Control issued a fairly comprehensive study on issues of prevalence and incidence of sexual assault and partner violence across the United States. And while there is a pretty broad margin of error in this study, the results confirm what other studies have shown previously. According to the CDC report, one in three women during her life will be the victim of sexual violence, intimate partner violence, or stalking. In addition, 1 in 4 men will be victims of the same types of assaults. 9.4% of the women who were surveyed have been raped by an intimate partner in her lifetime. That's almost 1 in 10. 6.9% of the women and 8% of the men have been victim of sexual violence other than rape by an intimate partner. 1 in 4 women, which is about 24.3%, and 1 in 7 men have experienced severe physical violence by an intimate partner in her lifetime. 10.7% of all women have been stalked by an intimate partner. And of all of the victims of sexual violence and physical assault, 70% of the female victims were first victimized before the age of 25. So with those really troubling statistics in mind, Kristie, could you tell us a little bit about what got you interested in Chicago Says No More and what your organization is doing here in the city?
Absolutely. Thank you, Cécile. And I want to thank the Chicago Council on Global Affairs for this kind of forum, because I think it is exactly what we're trying to do in terms of raising the dialogue, providing awareness, education, and engagement by individuals, because that's the only way, when you bring these issues out of the shadows, for them to possibly be solved and for there to be any kind of cultural change. I initially, and I'm going to go back a little bit, when I was a kid, about 9 years old, I had a paper route. And paper girls read the paper. And I found it incredibly disturbing. I didn't realize at the time that it was gender-based violence, but I thought it was very disturbing, the incidents that I would read about in the paper about sexual assault or domestic violence. And all I knew was that as a woman or as a girl, I actually felt like there was something different about how I was going to grow up. I knew I was afraid, and there were times when I would run my paper route just because of reading these things in the paper. In addition, it just so happened that my neighbor would expose himself to me. And so while I was smart enough to stay away from him, and I didn't really know what was going on because at 9 years old I hadn't really experienced anything like that, these things stayed with me my entire life. And so by the time I got to, let's say, November of 2014, that was the time when Nadia Ezeldine was murdered at Nordstrom. She was a fourth-year student from University of Chicago. And as I was talking to friends about it, it just occurred to me that it's not enough anymore to be individually outraged, that I needed to see what I could do to raise the awareness and talk about this more. So we gathered a variety of individuals from a number of groups within Chicago that are in this space. Sharmili's here from Rape Victim Advocates. She's one of them. Kathy Doherty from Battered Women's Network. Rebecca Darr from Wings. And we gathered together and talked about what about bringing the National No More campaign to Chicago, because I had seen the National No More public service announcements. I thought they were very, very effective. And I thought, you know, Chicago is a very socially responsible community. It's unusual, I think, and I've heard from CEOs that come here from other areas, that it's unusual the amount of corporate involvement and social responsibility here. And so because of my network, I thought, you know what, based on the statistics that we just talked about, 1 in 3 women, 1 in 7 men being abused at some point in their life, that means everybody in this room probably knows someone. And, you know, when you connect that with work, you're likely working with people who have been affected. So there's a lot of education that needs to be done, a lot more awareness. And we've been working on not only a public service announcement that's been showing on Channel 2, which is our media partner, since about July of last year. And it's a number of legislators as well as civic and corporate leaders that have participated in that. But we're also working on 4 different initiatives that our task force, which includes about 23 different social and social service leaders, as well as 16 other individuals that are either in the legal, medical, educational, or legislative arena. We've come together and talked about a variety of initiatives, and we've started with 4. And one of them that we're hoping to roll out, and we are rolling out actually next weekend in March, is a salon professional training program. And this has to do with the fact that salon professionals tend to have a very intimate relationship with their clients. And again, given the statistics, there's clients in there that are affected by either domestic violence and sexual assault. So this training program provides for 1 hour of mandatory training every 2 years, just 1 hour, every 2 years when their license is renewed. And we feel that through that training program, they'll be able to provide resources to these salon professionals so that if their client does ask about ways that they can find resources that they may need, that they'll have those available to them. Now, how does this affect girls? You know, again, I think there's about 60 calls on a daily basis to Chicago's domestic violence hotline, and the majority of those calls are households with children in the home. It takes about 35 different incidents of domestic violence for someone to actually leave. So we're trying to get the awareness out there and through this program reach into the households because there is a cycle of violence that occurs. I think you probably may know that children that are victims of domestic violence or sexual assault, you know, live with that and can become perpetrators themselves. So it's very, very, very important to get to them early and to try to provide some education and resources for them. One of the other things that we're working on is a program through workplaces, through their EAP programs, to provide additional policies and procedures for domestic violence and sexual assault survivors. So again, within the workplace, about 80% of organizations have workplace violence programs and policies. Probably only less than 20% have any kind of policy that relates directly to domestic violence and sexual assault. But there are a number of larger organizations that are starting to do this. For example, there's one large bank here within the city that allows business units to pay for temporary housing when someone has an issue. So these are wonderful programs that we want to expand and have a lot of corporations adopt. The third program that we're working on is a law clinic program, and I can talk about that a little later when we talk about legal and medical. And then the fourth one, what's the fourth one? Well, I'll think of it.
That's great. Thank you very much.
Sure.
And thank you for all the work that you and your organization are doing. In 2005, the World Health Organization published a really fascinating study, which is available online to download. I'm sure that your libraries can also get a copy for you if you would prefer to do it that way. The title is the WHO Multi-Country Study on Women's Health, Domestic Violence Against Women. And these were quite in-depth, carefully prepared interviews of 24,000 women in 10 different countries. And one of the things that this study showed is that no two countries are the same. There were countries where there was an enormous amount of violence inside of relationships, but where women were fairly safe if they were outside of their homes. Conversely, there were countries where there was a lot of violence outside of the homes. Women were very much at risk every time they left their homes, but inside of their relationships, they were relatively safe. There were countries that have much better records than the United States, and there were countries with really appalling levels of both domestic and non-domestic violence against women. So with that as a backdrop, why don't you tell us a little bit, this is a big day for UNICEF and the UN, I think. Why don't you tell us a little bit about what Girl Up is doing around the world, including on some of these issues?
Absolutely, thank you. And thank you to the Chicago Council. I'm so excited to be here talking about this very specific and important issue. Girl Up is a dual impact program. So we are the Adolescent Girl Campaign of the United Nations Foundation. So the UN Foundation's overall mission is to support the work of the UN, both from a communications and publicity standpoint, but also certainly through funding key programs. Girl Up is dual impact. So on the one hand, we galvanize, mobilize, and train adolescent girl leaders across the United States and around the world to really become the advocates for girls in the developing world. So they join clubs. We have registered over 1,200 Girl Up clubs in high schools and on college campuses worldwide. Actually, in both the developed and in the developing world, which is an interesting paradox that we're addressing now. And the girls get advocacy resources, they get fundraising resources, they learn how to become leaders, they become extremely educated on the issues impacting girls in the developing world, and this has become very much a for girls, by girls campaign. So they are on the front lines, they are the voice of this movement, and now we have about 500,000 supporters worldwide who are really taking incredible, inspiring action on behalf of girls everywhere. That leads to the other side of our program, which is actually the work that we are funding and partnering with through the UN in the developing world. So we have impact programs specifically for adolescent girls in 5 countries, in Ethiopia, Malawi, Liberia, India, and Guatemala. And we will be adding Uganda early this year as well, which we're very excited about as we expand and grow. And we work with key UN agencies, UNFPA, the Population Fund, UNHCR, the Refugee Agency, UNICEF, UN Women, to implement these programs. And as you said, no 2 countries are alike. So the comprehensive services that we're providing for girls in these different countries tackle everything from access to education, keeping them free from violence, access to health services, creating leadership opportunities for them, and also being counted. Something very simple as birth registration, which is a huge issue. There are 50 million children who are never registered at birth, most of which are girls, and that essentially creates an entire generation of invisible citizens who can't necessarily get into school, and they can't own a business someday or own property or a home because they don't exist. And then you see the increase of sex slavery and sex trafficking and violence and child marriage and all of those things as a result of something as simple as not having that birth certificate. So those are all the issues that Girl Up is really tackling through these individual programs on that level.
Thank you very much. The CDC report, which I mentioned earlier, talks about the health effects, both short-term and long-term, of being a victim of either sexual violence or of domestic or partner violence. They report that some of the survivors' physical problems include physical injury, of course, mental health consequences like depression and anxiety, low self-esteem, suicide attempts, gastrointestinal problems, substance abuse, sexually transmitted diseases, gynecological problems, including those related to unwanted pregnancy, and pregnancy complications. Not to mention that a shocking amount of partner violence leads to murder. So could you talk a little bit about how your organizations are dealing with health issues as they relate to the survivors of sexual and partner abuse?
Well, one of the things I wanted to talk about in terms of medical has to do with one of our steering committee members is the founder of Test 400K, and I don't know if anybody remembers, but there was a point in time in Illinois when there were 400 rape kits that were untested. And so we're partnering with them in April to have a forum to pull together medical, legal, as well as technology individuals, because other states have solved this issue, but somehow here in Illinois and within Chicago also, my understanding from talking to people is that rape victims are often told that it will take a year to 18 months for their rape kit to be tested. Now, that's just unacceptable. I mean, you and I know that we can track a package from Amazon pretty much by minute, and it doesn't seem like the technology or even the chain of custody that's required for the legal process has to be so complicated. So these are very important things that we need to work on that affect future, because when it comes right down to it, there are a number of instances where people that sexually assault other individuals sometimes are serial rapists or serial assaulters. And so the faster we can get these test kits tested, the sooner the detectives can do their job, and we can send that information to the national database that then can identify people, and you're going to just help a lot in terms of reducing the incidence of this overall. The CDC report that we were talking about also, in 2009, they did a study across 5 states where they talked to 22,000 different adults, and they talked to them about where they had been affected long-term by some abuse that had happened, and it's called the Adverse Childhood Experience Study. An adverse childhood experience can be anything from an assault or verbal abuse, or it can be having in the home a divorce, domestic violence, some kind of substance abuse, or having a parent incarcerated. And during this, when they did this study, they found that 59% of adults had at least one of those types of incidents in their childhood. And as Cécile indicated, those long-term effects can be as minimal, I guess, as having obesity, but having diabetes, having earlier congestive heart failure, and sometimes just having earlier mortality rates, so dying earlier in life. So the health issues that are related to these incidents, unless there's the resources to provide people counseling and access to medical, can be long-term and very, very dire.
And along those lines, I mean, you have to really feel for a woman who, first of all, has been courageous enough to go to the doctor and say, I've been raped, and to ask for a rape kit, and then to be told by authorities, well, sorry, but it's going to take us 18 months to get to your case. I mean, that would just really amplify whatever emotional distress that she's feeling at that time, wouldn't it?
Well, the first person that an individual talks to, which is why it's very, very important to have these advocates through RVA, the first person that they talk to is how they feel about themselves. And so if the first person they talk to when they have a sexual assault starts quizzing them about what were you wearing, why were you out, what were you doing, were you drunk, those feelings will stay with them and, again, have long-term effects. And so it's very, very important that the first words to this person are, I believe you, I support you. And that's just...
Absolutely, thank you. I'm reminded that even in the US until 1995, many states required rape victims to pay for their own rape kits. And there was finally a federal law in 1995 that said that states had to pay for the rape kits. And so if the richest country in the world has this much difficulty investigating and dealing with the victims of rapes, how much harder is it for some of the poorest countries in the world to deal with this issue?
Absolutely. So in Guatemala, the group that we work with, the population of young girls, they're an indigenous population in a very rural part of Guatemala. And going into this program, they actually had to start by defining the word violence for these girls. It wasn't a word they understood or familiar with, it was just a state of being. So child marriage, domestic violence, all of the things that they were facing weren't even a defined term for them. So if it's not even defined, it's certainly not recognized. It's certainly not talked about or prevented, and then therefore the repercussions. There are girls in Guatemala giving birth as young as age 10, and they also don't have access to health services, so they're dying. Youth pregnancy is the second leading cause of death for girls under the age of 18 worldwide, and suicide is actually the #1 cause of death for girls under the age of 18 worldwide, a lot of times completely related to violence against girls. So in the developing world, you're starting on such, it's not even an even playing field, or the foundation is so much lower, where just the complete lack of access to the knowledge, to the understanding of girls' rights in so many of the countries that we work in, where child marriage is actually illegal. It's not legal. Girls have to be sometimes 16, sometimes 18, in order to be married. Girls don't know that. Their families aren't telling them, their communities aren't telling them, and so girls don't actually understand their fundamental rights as girls in their society. So to be married at age 12 is a norm, and it's something that happened to their cousin and probably happened to their sister, and they don't even know to question it. So that's really where we're coming in creating. You have to start with that base of knowledge, of education, not just access to education in schools, but really just access to education of their rights, of what it means to be violated, of what violence actually is, and all of those things, and then to build from there with the health services and education and leadership opportunities. But you're starting so much lower on the ground and really creating that foundation for these girls.
That's great. Thank you very much. It's so important. We were speaking earlier when we were talking about how much has changed in the United States just in 40 years, just since the 1970s. Early 1970s, I don't think there were any shelters for abused women in the United States. Rape shield laws did not start being passed until the 70s. Before then, a woman could be asked very personal questions on the stand in a rape trial. Training of police and of judges changed markedly beginning in the 70s. And so we've come pretty far, actually. My question for you, Kristie, is what's the next frontier? What do we still need to do to service the victims of sexual violence and of partner violence more correctly, more progressively? And in the rest of the world, how can we share what we've kind of learned and built up in this country with countries that still have a ways to go in some of those legal and legislative areas?
You know, I think when I was looking at some information, I was kind of stunned to learn that only 1 in 20 individuals that are sexually assaulted on college campuses report that, because there still are not enough support services and there are not enough protections for individuals that want to report. So for example, let's say you're at a college or university where there is a strict rule against consuming alcohol. Maybe it's a religious college campus, maybe it's just a smaller liberal arts school or something. You know, sometimes students don't come forward because they were drinking alcohol and they're afraid to report the sexual assault because there are fear of this other incidents that might happen to them. And so there needs to be amnesty programs for being able to talk about sexual assault and reporting it on college campuses. You know, we had worked with Lisa Madigan's office, our Attorney General. She had championed last year, and I think it passed in August and will go into effect in August of this year, the Preventing Sexual Violence on Campus Act on college campuses, and that's going to go a long way in terms of requiring more strict reporting on college campuses, providing resources to counseling and mental health. It's going to, at some point, we also need to address the issues related to if kids on college campus have been sexually assaulted, where do they live? Do they live still in the same dorm where maybe they were sexually assaulted and the perpetrator lives? You know, we need to address all these student life issues, and right now there are a number of, and that's actually our 4th thing, is that we're trying to focus on provosts, presidents, general counsels, and trustees on college campuses to really get them to understand that this is a student life issue. It's not a legal and insurance issue. And so while they've been sued, and there's over 170 schools now that have been sued through Title IX by individuals, which I think is a great way to go, but they really haven't, there needs to be a lot of change on these campuses in order to address these issues.
For us, I think there still is so much, we've become a very borderless world because of the internet, because of the access to information that we all have, and yet there is still so much of this us versus them stigma out there of what we're doing here and what they are doing over there. And so I think it's critical that people here in the US and in developed nations worldwide really become educated about what's happening, and not just in a way of, you know, hashtag bring back our girls and posting. I mean, that's wonderful, and it's wonderful to be part of a movement, but action has to be there, and that starts with education. I go out and, you know, when I tell people that every day while we're sitting here and going home to our families tonight, 35,000 girls between ages 10 and 17 are being married to adult men every single day. And it's happening, and it's happening rapidly, and that number is growing every year. And I just last week saw a video on Facebook that's a YouTube video that is in Times Square, and it's an older gentleman, probably in his 60s or 70s, and a 12-year-old girl who looks like a child bride, and people are shocked. They see this because that doesn't happen here. And it was an organization just trying to show that this is what's happening, that we are seeing something that is so appalling and disgusting because we can't fathom that. And it is happening to 35,000 girls every single day. So it's really, really becoming educated on those issues and understanding that it's not us versus them. There is one world, and we are really, truly all responsible for one another. And that's what's been so incredible and inspiring about the girls that we have that are leading this campaign, because they are out there learning about the issues and taking as much action as they possibly can at, 16, 18, and 22 years old. And with that, over the course of about 14 months, the Girls Count Act, which is a piece of legislation that was in Congress that provides birth registries, as I mentioned, to girls in the developing world. It's U.S. support for that in the developing world. Our supporters took almost 400,000 advocacy actions, going up to Capitol Hill, meeting with their members in district, writing letters, making phone calls, actually out there doing something. And that's incredible, and that's inspiring, and the president signed that piece of legislation into law. And so we have to learn from this younger generation of youth who really are connected on a global scale. And in a lot of ways, they're learning more about what's happening in the world than we are. And they want to do more. And as a whole, we have to encourage that. And we also have to learn from them in order to really understand that we are responsible for everyone. And there is something that every single person in this room can do.
Thank you very much, Anna. I know we have a lot of physicians in the audience today, which is great. There's been quite an effort over the last 18 months to educate physicians on ways that they can help, first of all, recognize possible sexual and physical abuse among their patients, and then point them toward the help that they need. I'm wondering if either of you have any ideas on the ways that the medical community and the legal community can kind of move to a new level of supporting women who have been victimized in this way.
First and foremost, I think more female doctors in the developing world is really key. More women, regardless of where they're from, certainly women who are from those countries, who are trained in those countries and really can respond to those issues, as well as women in the legal field, women in leadership positions, period, are really key to having that impact because they have an understanding and the ability to fight against these cultural norms that are happening there in a different way. I think all of the organizations that are here, Doctors Without Borders, and similar organizations who are sending our doctors to the developing world to do a lot of that work is really critical as well. And it would be great to see more female doctors in that program in addition to that, just because of the same thing. They understand girls are more comfortable speaking with women, they identify with them, and it's a different relationship that develops that can actually change the trajectory for that girl. So we need to encourage it, and we need more. But very specifically on the ground, girls need those opportunities to finish school, to go to medical school, to invest back into their own communities. Data across the board shows that women invest more back into their communities than men do. So whether it's education, becoming a doctor, becoming a lawyer, holding a position of leadership, they are going to bring that back home to their own community, and the ripple effect of that is massive.
And I've seen in the countries where I've worked that having female police officers is really important. Female lawyers is important. And as women move into those professions, first of all, there is pressure at that point on lawmakers to provide the legal framework that is necessary to deal with these issues. But also, as you say, women are more empowered to get the kind of help that they need.
So I think I had mentioned before the law clinic task force that we have, and that's really focused on the fact that students provide services to domestic violence and sexual assault survivors. And so we want to have the law clinics throughout Illinois have standard procedures for how this is handled, and we want to be able to educate these law students about sexual assault and domestic violence so that they're not going in there blindly and they know exactly how to provide services and provide the best information. We also, Rape Victim Advocates also works with the medical community and a lot in the emergency rooms because their advocates go along with the victims to the emergency rooms. And so they're frequently watching what happens there and talking to the medical personnel about the best ways to handle situations. We also have, through Battered Women's Network, a courtroom watch program where they'll sit in the courtrooms and watch different proceedings to see how different judges handle these cases, how different attorneys handle them, and to take notes on what kinds of things come up so that they can address them with the court system and try to work for survivors.
That's fabulous. Thank you. Thank you very much. I've learned so much from both of you today. Thank you very much. We want to give the audience time to ask some questions. There's a gentleman right here in the front. I just want to commend all the men and young men who are here today. Thank you for being here today, and we'll take a question right there.
Thank you very much. Thank you for all the work that your organizations are doing. My name is Tom Hanchman. I'm the Executive Director of the CARE International office here in Chicago. And CARE pays a lot of attention to the plight of women and girls throughout the developing world. So on behalf of CARE, thank you for the work. And also as a father of two daughters, one who's a 21-year-old junior at a private college in Iowa, and also another one who's a sixth grader, starting her puberty right now and dragging me through that. Thank you for the work you do. I wanted to take it a little bit off topic from the issue of rape and sexual assault. The issue of honor violence in the developing world in many countries is a big deal, and bringing that practice to the United States and the whole female genital mutilation practice. Do your organizations address that? And if they do, would you speak to that? Because many people don't understand that issue. Thank you.
Absolutely. Female genital mutilation is a huge topic that our country programs focus on, because whereas with typical gender-based violence that we are talking about, men are the perpetrators. Oftentimes with FGM, it's actually the women in the community. It is the mothers, it's the elders, it's the women who went through this practice, and again, it is part of their culture and they believe in it. And so who are the advocates there? If it's not the women who are stepping forward for the girls, and it's not the men, then really those girls have no voice and they have no advocate. So those are the types of programs, and as I said, starting fundamentally with girls understanding that that is actually not okay, that they do have rights, that it is illegal in most places, even though it's still practiced. And so giving them just the foundation of that knowledge, and then we have all of our programs access to critical health services, and part of that too is the health education of getting to the girls. But that is the one issue that we certainly address women far more than we address the men, because the women are the perpetrators of that, and it's so important. But it's a much bigger upheaval to really have to change an entire community, and not just, oftentimes with gender-based violence against girls, women silently go along with it, but they don't necessarily approve of or believe in what's happening to their daughter, but they don't know how to speak out. And in this case, they actually do. They believe in what's happening. They believe in FGM. And so it's a greater uphill battle to really tackle that issue. So it's important to go directly to the girls. It's important to get to girls in safe spaces, in after-school programs, creating community centers, creating community programs, bringing that knowledge into schools, starting in elementary school, because by the age that girls are suffering through FGM, many of them aren't in school anymore. So you actually have to get to them at a younger age, at the early elementary school level, so that they know by the time this comes up that there may be other options, other programs in their communities, and a safe way out. But it is absolutely a critical issue.
Let's see. There's a lady right here in a burgundy sweater.
Hi, thank you guys both so much. I have a question about the No More campaign, either in Chicago or nationally. I'm wondering if abuser intervention programs is a focus. It's something that's talked about. I know really often in the for judges or in the legal area, this is something that's mandated for abusers, but we know that marriage counseling, for instance, or anger management programs aren't really what's needed. And so is this a focus for?
It is a focus. We actually have a member of the steering committee who is very interested in this area, and he actually is a reverend, and he is trying to put together some additional abuser intervention programs. Right now, those programs tend to be very short-term, so they tend to be maybe 6 months or something where they need to go, and it needs to be a longer period of time. There needs to be more legislation around that. And so we do have that on our radar to address and for people to push forward, because it is something that we're interested in focusing on helping abusers also, because there is that side of the equation where that's an area that needs to be addressed too.
I just wanted to say one thing about honor crimes, because I realized we didn't answer your question. For me, having lived in countries where they're very common, one of the key things is shelters for the women, because they know they're about to be a victim and they want to get away, and they very often don't have any personal economic power. They very often are very young, and if they just have a place to go where they can be safe and get someone to help resettle them somewhere else, we can save lives. And it's the same in the U.S. I mean, sadly, there have been honor crimes in the U.S. too, and if the women can go to a website like Chicago Says No More and find out how to contact a shelter, then that's really important. But to my mind, that's one of the really key things that can happen very quickly, is give these women a safe place to go. Now, another question. I'll get it this young man has a question right there. Hi.
So how do you reach through the people who think it's their fault and don't report the crimes? And how do you stop that mentality among people who later realize that they're being affected by this?
That's a wonderful question. So I think that awareness is very powerful. I don't know about you, but in terms of social media, if you start to see people on social media support survivors of sexual assault and domestic violence, if you support within your school individuals that have been maybe slut-shamed, you've got to have that support in order for these women and girls to be able to come forward and talk about it. Because they're not going to come forward if there's not that support that they feel they need in society. There's a book that's coming out called American Girls by Nancy Jo Sales. I don't know if it's out yet or not. But she talks in there about the fact that social media these days is something that we haven't caught up with in terms of understanding what young girls go through, in terms of how they're bullied and how they are abused and how they are slut-shamed. A lot of kids post these nude pictures now. And so in order for those kids to be able to come forward, there needs to be a network that provides counseling and support to them that says this is not okay. It's not okay in schools. You have to educate the educators. And again, it's an awareness and education initiative.
Do you want to say anything? Thank you. That was a really good question. Thanks. Let's see. This lady right here, maybe could, yeah. There's a gentleman there with a mic.
Thank you very much. What you presented is great, protecting the victim. How about the culture of victiming women, raping? This is happening in the United States in very prestigious universities and in countries all over the world, even a very large country which is very famous for democracy. How about educating men not to rape? What kind of program we have internationally? Thank you.
So making it culturally completely unacceptable to engage in this type of violence. What can we do?
That is a very loaded question and such an important issue. I think on so many levels, rape and sexual assault is one of the only issues that I can think of where you actually do blame the victim before you blame the perpetrator. And it's such an interesting cultural phenomenon that has happened. We see it in domestic violence. What did she do to deserve it? We see it in, especially with youth, with college students, she was drunk at the party. It's across the board, and it absolutely happens here. And you're right, if we, as a country who is sort of at the helm of leading this world in a lot of ways and being an example, if we're doing it here, then it's really hard to change that elsewhere. And it's hard in the countries that we work in to really get those cultures to start moving in that direction. Men and boys are the biggest part of this conversation. And oftentimes it's women who are doing the work, it's women who are doing the counseling, it's women who are putting out the education and the awareness building and all of that stuff, and we need a lot more men and a lot more young men's voices in this conversation about that, about how do you put it on them to not rape women, to not abuse women, as opposed to looking at what can women change and how can we empower girls. If we can educate boys, if we can change the stigma of what being a man is in our country and certainly abroad. There's a wonderful organization in DC, Men Can Stop Rape, and that is, true in their name. It is what it is. If men change traditional masculinity to understand the respect of women and not asserting your power in that way to victimize somebody else, that's where it has to start, and we need more men leading that charge.
So there's an organization here in Chicago, and there's probably more than one, but it's through youth guidance, and it's called Becoming a Man. And they, as one of their 5 values, have respecting women. And we've been talking to them. I've been talking to them a little bit about, I met a co-founder the other day, and we were talking a little bit about extending that to have conversations about consent. I think that, again, dialogue and conversation is a lot of what's needed, and these are difficult conversations when you're talking about consent. What is consent? Or when you're talking about, bullying or power and control and the masculinity that Anna talked about. We also have individuals on our steering committee. One of the aldermen in the 19th Ward is showing the hunting ground to high school students because he wants the boys within these high schools to see the hunting ground and to understand more about the rape culture that exists. So a lot of it, I think, again, has to be the dialogue and starting through some of these organizations to really have these conversations and to expose these kids to it.
Thank you very much. And I think that's really a strong and appropriate place to end this really fascinating and excellent session. I'll give you all a chance in a moment to thank Kristie and Anna for their participation and their really superb work. I just wanted to mention an agenda note. From here, you will move down to the second floor to attend the breakout session. If we could ask those of you with young knees to consider taking the stairs, that will leave the elevators for those of us who have less than young knees to take the elevator down. But having said that, thank you all for being here today, and let's thank Kristie and Anna for their participation.